Healthcare in America is broken, and people wait until something breaks and then they go in and they're captive to a system that has very little transparency. We need something that's lower cost, we need something that's higher service, and something that's more transparent.
Welcome to Small Strides, Big Business, the podcast for insurance agents who want to grow their business in a way that feels smart, sustainable, and authentic. On this podcast, we have honest conversations about better sales interactions, client service, automation, mindset, marketing, referrals, practical things that move your business forward in real life. Whether you're brand new or years into the game, so grab a notebook and let's dive into today's conversation. Hi, everyone. Welcome back to another episode of Small Strides, Big Business. My name's Krystal Small, and I have Mark Seghers here today. He is the CEO of Inspire Health Tech. Mark, thanks for joining me.
Oh, you're quite welcome.
I'm
Thanks for
excited
having me.
to chat. Yeah, this is going to be a good conversation. And I know that you are the CEO and founder of Inspire Health Tech, and you founded that business with the mission to disrupt health insurance the lead business by focusing on consumer orientation. So I love that. But you have a huge experience, not only in entrepreneurial, but also in the technology background. I know that you were a programmer moving up to leadership roles, and you've worked for national carriers. You've got quite a resume and a couple lifetimes worth of experience, I think.
Yeah, well, I'm already a couple of lifetimes worth in age, so
I
supposed to
didn't know. No,
follow.
that's not where I'm going. We are as old as we feel.
And I'm even older. No,
Goodness.
just kidding. No, it seems like a long time ago that I was a programmer, but yeah, I started in IT, and I've been fortunate enough to enjoy a kind of a varied sort of career, both working for multi-billion-dollar companies all the way down to entrepreneurships with just a handful of us.
Awesome. Awesome. Lots of world experience to pull in, which hopefully we'll get to a little bit. So let's dive into it. Can you tell me a little bit about Inspire Health Tech and, maybe how you got there with all of your experience?
Sure, sure. Well, I come from the insurance world, the health insurance world specifically, working in IT and then leading, rising through the ranks in IT and leading e-commerce for two national carriers, one and then the other. And I've lived here in Wisconsin my whole life. I've been tried to pull a couple different ways, but always stayed here for good or for bad. And now it's getting into the good as things warm up.
Yes, right.
But I've had a number of entrepreneurships, and I've got to be honest, man, I really like that a little better. The big corporate sort of bureaucracy sort of taught me some things about governance and about repeatability, maturity, and a lot of the IT type stuff. But I enjoy doing things that are a little different and that sometimes I feel the market may need. A couple times I've been wrong about that, but most recently, my past startup was acquired by a global actuarial firm, that one of the largest in the world. And that led me to be interested in predictive analytics and how AI can actually provide data or can benefit from data to help consumers make good choices, like much in the way that people are all using AI right now. AI is only as good as the data that goes into it.
Yeah.
What we do is we provide recommendations for consumers to help them align to the right, either under 65, ACA coverage, or Medicare plan. And these are both extremely complicated worlds. It's almost as if they're not really meant to be understood.
Uh,
And even people in the industry, they still talk to their agent because they don't really understand, all the ins and outs and terminology, right? So what we do is we help the consumer first align to a plan that meets their coverage needs. And then our partners connect that consumer to an agent who sells that plan.
Awesome.
So for the consumer, they've got the plan algorithmically selected to save them money and to align to their coverage needs, prescriptions and medical conditions, predicted claims. And it's a predictive claims based analytics. We can align this person to a plan that seems right for them and is projected to save them money. And then our partners connect them to an agent who sells that plan. So for the agent, it's great because that lead, that consumer, is already sort of pre-convinced to buy a plan they sell, and they can kind of put away that hard sell for a moment and focus on helping that consumer understand the ins and outs of that product they know so well as an agent of that plan.
Excellent. Awesome. Okay. So
Faster sale and closes more frequently, and everybody's generally happy.
yeah, absolutely. So I know we talked about this before. Whoever's listening out there, they wouldn't necessarily reach out to you and connect with you, but they would connect with your partners. Correct. So do you want to share who some of your partners are? Is that something that we can say?
Yeah, sure. There are competitors, some of them, so I try not to talk too much about them. But Qualphone is a company that runs a portal called Medicare Harbor. Dot
Okay.
com, just like it sounds. And Quinn Street's another customer. They're a company that runs a consumer presence called Insure.com.
Okay.
You'll see it on billboards across the US. The
Absolutely.
whole idea for our partners is, again, to help that consumer align to a plan that's a good fit for them, and then connect that lead, then that
Yeah.
pre-plan aligned lead, if you will, to an agent who sells.
Absolutely. So if I was an agent and I like what you're saying and I believe that you're going to bring in the best leads, I want to partner with the people that you're giving your information to. So tell me, I know when we first talked,
Mhm,
we talked a lot about integrity in the insurance industry, and I know that
mhm.
that's really the foundation of what you're doing is trying to dif- you know be responsible in the information that you're giving the consumer. So, chat a little bit about that for me, if you don't mind. How has prioritizing your customer needs really positively impacted your brand and your business overall?
Sure. So the leads business is not necessarily always known as the most honest and forthcoming business. A lot of times, and it's not everybody. I mean, there's a lot of very high quality, very, ethics companies in the leads business, certainly. But there are other players, and some very big volume players that post advertisements to consumers that are, in my opinion, misleading. They promise in many cases fits that the plans that are represented by the lead buyers don't necessarily come through on grocery benefits. Hey, click here to get $400 more a month in groceries, or worse than that, and oftentimes they're preying on people who are the most vulnerable, maybe people who aren't very well informed, people who have low incomes and are really in need of those savings. And, it's those that's the reason that I really keep going on this mission, is that I believe that there's a way for there to be a win-win where the consumer is presented a plan that can save them on the average about 34%
Wow.
as compared to a random plan the agent kind of sold at them, right? And that information is gettable, and we put together through our actuarial partners a model that really helps people. So, I do care about ethical capitalism, I think. You know, Capitalism by itself, there's nothing inherently evil about selling a product that people need. I think where it gets into deception and enforcing products on people that are uninformed, especially with high pressure sales tactics, I don't think that's necessary. And more to the point, I think it's wrong.
Yeah, absolutely. And it sounds like, I mean, the idea of choosing a healthcare plan is just innately, overwhelming, any insurance. So I think that it sounds like your platform is also taking away some of that for for your client by asking the right questions or leading them the correct way. So, not only is it great
Mhm.
for them on the outside or at the end of the situation, but the whole process, it seems like, is streamlined a little bit better than
And we not only streamline it for the consumer, but this can really streamline things for the agent as well.
yeah.
You know,
So
Not only are they getting out of that high pressure, push type sale, but what they're able to do is now they're starting with somebody already convinced to buy the plan they sell. Now they can really focus on, let's get you enrolled. Let me answer any questions you have, and really kind of get to that helpful subject matter expertise that every consumer needs. So there's efficiency all the way across this spectrum of that sale.
And is your platform mainly or just healthcare, or do you do, PNC and home and auto and all of the things?
Yeah, right now we're focused on healthcare because I think that's where the biggest confusion tends to be is around health insurance and both ACA, and now the ICRA platforms is a new deal as we just talked about earlier, but then also the Medicare world, and I think it's sort of exacerbated by the fact that for many years, many of us have worked for companies where we didn't really think about insurance taken out of our paycheck and the premium was sort of there every year. We maybe check a box, and then we go to the doctor and they pay some, we pay some, and we're sort of insulated from a lot of the aspects of that decision through our employer coverage. Now with ICRA and with many other constructs, employers are kind of throwing up their hands, many of them, and saying we can't do this anymore. you know you're kind of on your own, and it's a scary place to be. And that's can be compounded when you think about seniors and you think
Yeah.
about, being on a fixed income and not having much money at all and needing to make the right decision. And the wrong decision is can be quite costly.
Absolutely. Yeah. I don't know the statistics off the top of my head, but I do know that overall in this country, medical bills are, one of the top forms of debt for people. So,
Yes. And, we're leading the world, I think, in terms of bankruptcies related to health conditions.
mm, yeah.
So anything that can help with transparency, I think is a good thing. And kind of stepping away from my domain for a second, I am also a firm believer in healthcare transparency. And
Mhm.
that was my last startup was related to healthcare transparency and helping people with the decisions surrounding wellness and, helping themselves be healthier.
Yeah.
And, I think that's where it starts. But I think the industry needs to find ways to step forward and help people understand the costs of things and share in those cost decisions up front, like when they need a procedure or they have a, confusing health condition. I know AI is helping with a lot of those. A lot of those decisions. And you think of the cost of visits, a lot of people are using AI and hopefully correctly. But I think the transparency has to also cut across the costs. A lot of times people don't think about it. They just go with the referred doctor and they just go in and then whatever is paid and whatever they pay, they pay. They find out later after the fact. Many times they don't know the quality of the physicians. They don't know the price of the procedures until after things are decided.
No, 100%. Um, yeah, I know that there's a lot, for example, an MRI, you can go, 20 miles north and 20 miles south and get different rates, right? So
Yes. Hugely
it's
different rate.
overwhelming on many levels. Well, so speaking of AI, let's talk a little bit about that. How do you see AI overall impacting healthcare, not just with your app or your program,
Yeah.
but overall, over the next who knows? It could be 6 months, it could be 6 years. We're moving very quickly here.
Yes. Healthcare in America is broken.
Mm.
And it's people wait until something breaks and then they go in and they're captive to a system that has very little transparency, as I've mentioned. So we need something that's lower cost. We need something that's higher service and something that's more transparent. We also need to understand kind of the relationship between wellness and healthcare. We treat our cars better than we treat our bodies many times. And so when we talk about AI can do many things. And I think, it's like when the internet first came in, everyone talks about, oh my God, it's terrible and it's dangerous. But then there's so many people talking about how great it is. And eventually, it sort of just becomes the way of things. AI is right now the hype curve, the Gartner hype curve. We're in the plateau, or we're in the peak of inflated expectations, and we're probably hit this trough of despair, right? And then we come up to the plateau of productivity where you finally it's built into everything we do and we don't think about it. It's just kind of AI. So in healthcare, I think that's going to take several shapes, and we each, Inspire Health Tech, we have our little thing to help people find the right health coverage. But AI in healthcare is just monstrous. And you see Gen AI, generative AI, ChatGPT, and all the various forms of that. people, spend 20 bucks a month or they get it for free and they ask all kinds of questions about their health.
Mhm.
And, doctors, a lot of times you'll go into the doctor and you bring them what AI says, and the doctor be like, yeah, that's pretty good. That's right. You can even take your MRI results and your X-ray results and your blood tests and feed in all the things that happen. I just had a blood test the other day, my annual checkup, and it gave me pretty much word for word what the physician had said, and it's kind of cool. Physicians are not infallible. They have strengths and weaknesses. AI is able to grab from the context of all that is known about medicine and bring it to bear and personalize it based on the details of what it knows about the person. So I think that is going to replace a lot of primary care, the need for primary care. And that's good in a way because primary care physicians are in severe shortage and it's getting worse. And
Mhm.
they're spending 2 hours of paperwork for every hour of care. It's crazy. It's inefficient. And, our system is broken, as I say, in so many ways. What AI can do, I think, is bring some of that knowledge, democratize some of that knowledge that's been held by, sacredly, sort of secretly by the physicians. I don't mean secretly in that they're holding back, but it's, we don't have medical degrees and
Yeah.
we don't understand what things mean. AI is always there and can help us with some of that. And so I think that's going to reduce the need for some costly and maybe some unnecessary maybe visits. And sort of now we have the strip malls that have blood tests and have MRIs, and you just go and you pay for it and you get it. That together with AI is gonna replace a lot of things. So that's kind of what I see as the big benefits. And of course, it goes without saying, yes, it can be misused. Yes, people can make bad assumptions. And yes, AI is incredibly sycophantic. It will say, "Oh, you're so smart for thinking of that," or you're so smart for, doing this form of workout without knowing details of how it might be dangerous for you. So as long as people feed in all the right things and understand the context and hit it from 18 different angles and fight those sycophantic tendencies for it to make you feel really good, as long as you fight that stuff and beat it to death, you can come up with some a pretty good assistant. And my version of Gen AI, I use ChatGPT and Perplexity, but they know all about me, all my health, my family, my personal situation. They know about my business. They know about my business partners, my sales prospects. They help me. It knows my context because I've spent a lot of time telling it, how I function, how I work in my environment.
Sure.
So it's learning how to use AI and where its weaknesses are and where its strengths are. It's true in healthcare, certainly, urgently, but it's also true across the spectrum of how we use AI.
Absolutely. I'm right on board with you with, preventive healthcare, right?
Uh-huh.
We're very reactive at this point in our healthcare. So I'm hoping that, and I am seeing in some instances that, through some data collection and some vital, options to take your vitals and whatnot to be able to preventively catch some things, which would be ideal as well. And in this grand scheme of things, lower healthcare costs when you can catch something early, right? So
Right.
I think there's a lot of benefits to that. And then there's always the conversation, in any field, there's the adopters and then there's the people who are fighting it. So I agree with you. It's becoming mainstream. When we look back at this, 5-10 year stretch, I don't even know if it will be 10 years, that this big AI boom and how things are moving so fast. But I do think that you're accurate in maybe the primary care offices that adopt things are going to move a lot quicker than those that don't. And of course,
Yeah, I agree. It's something that's taking over. I think and without getting too much on a soapbox, we have to be very careful though that it stays pure,
yeah,
And right now we're sort of in this phase where it's sort of in the golden age of the promise of AI. And it's pretty close to free and there's monstrous data centers that are being built and they're not making any money on it yet, but when it's all integrated into things, that's where things can change.
Sure.
That's where commercialization enters in, and hopefully that commercialization doesn't enter into the advice that's given.
Mhm. Mhm.
Which drug should I take? Well, the drug companies, seeding it a little bit so it leans a little more towards this way or that way. There's so many possibilities for abuse of AI. And we've seen some of that, some AI leaders that are sort of, changing results to steer away from this or to avoid talking about this. And, those are kind of the early sort of biases that are being introduced. But as commercialization happens and AI needs to make money, obviously. We've got to make sure that the advice it's stays safe and stays accurate.
Yep.
And that's something that I'm concerned with more than anything else.
Absolutely. Well, leading back to the conversation about integrity and, you know,
Integrity. Yeah.
consumer, under I guess just truth.
Truth, yeah,
Yeah.
and we all need to find truth these days. I think truth is becoming harder and harder to find. Again, here I go stepping on the soapboxes again. I have to be careful about that. But I think, back in the days, Walter Cronkite, he'd tell you the news and you'd believe it,
Yeah.
because there was
Yeah.
no reason not to. And these days, I think it's harder and harder to know the truth, and we fall into our little groups and our little bubbles, and we believe what our bubble believes, and we don't hear any information to the contrary. We only hear what we believe and what supports our prior beliefs,
So
and tending to separate us. And if AI can be a voice of truth, scan through all the noise, eliminate all bias, and present both sides
mm,
and present the totality of what's there. But of course, that requires curiosity. We all have to have open minds. We have to have curiosity. We have to spend a little time. And that's, I think we need to interpret things. We need to stay human and
yeah.
stay creative and stay open minded.
Yeah. Yeah, absolutely. And anybody can be an expert in anything these days if you go on social media, right? So,
For sure.
um,
Yeah, even me, we all, I'm a generalist. I know a little about a lot of things, and I think we need specialization, but I think ultimately as we talk about AI, the question becomes what ultimately is human and what's protectable, you know, what can we continue to carve out for the foreseeable future as AI takes over all not only the blue collar jobs, but
yep.
takes over the white collar jobs
Mm,
and takes over all these consulting jobs, physician jobs,
mm,
lawyer jobs, all kinds of things. What ultimately is the true value of being a human being? And that's where we have to lean our jobs and lean our efforts towards those things that are uniquely human. You could argue forever about what those things are.
yeah. Yeah, well, the human element, we need to keep that in, yeah.
Personal
Um,
connections, yeah, are one
yeah.
thing.
I think that there is, there's a way to use the AI as the tool, and that's just something that people are gonna have to continually, I think that's gonna be a continual conversation, decision, battle, whatever you're at that moment, but what is humanly necessary? When is a human necessary? And, even with healthcare, I was talking to my doctor when I was at a visit the other day, and we were talking about AI, and I said, "Oh, I can put
Mhm.
all of the medications, all of the ingredients right in AI, and I'll send you a list." And we're just talking about at what point are bots going to be taking over versus humans doing procedures, and it's, yeah, we'll see what happens, but there's definitely, it's a bigger conversation, Mark.
Sure.
All right. Well, I would love to just pick your brain a little bit about just entrepreneurship since you have been down that road for years in many different ways. And I think myself, for sure, but I do believe that there's some people that are listening or watching this that are either starting out in the entrepreneur world or moving into the next phase. Lessons learned. I know that can be a loaded question, but in all of your experience as you are a serial entrepreneur, what challenges and lessons have you learned through starting new businesses and growing them, maybe even selling them? What are a couple of things you can tell somebody if they're just new to that new business world?
Yeah, great question. It's a big question. There's some people who are in a job for a long time and they're happy to have the paycheck and have that repeatability in their life and to be on that train, and that's awesome. I'm glad there are people like that. There
Mhm.
are other people who want challenge and want to find meaning in their careers and, and want to maybe leverage their what they're good at,
Mhm.
and I think you can have all of that. But I think in terms of, we all got to make money, right? So you have to pick something that sort of intersects the thinking of a Venn diagram of things I'm good at, things I love to do, and things that make money, right? So you've got to find that intersection or somewhere close to that intersection, and then you'll love work and you'll never want to retire. I think what happens is people focus on what makes money and it drains their soul because they're doing something that maybe isn't really helping people, right? Or maybe they're not able to stay at it because they're not really good at that thing. I really think it's the combination of those three things that people have to think about. And then when they choose that opportunity, they have to find the balance between making sure that the thing isn't too small. There has to be an addressable market, and that has a need for a service where there aren't already players providing it. So you got to do some research. You have to understand the pain points of the people who might be your customers. You have to ask a lot of questions and do a lot of research first. And then also you need to make sure that it's not too big. Make sure you're not trying to cure world hunger because, unless you've found a way to do that, great. But, make sure the problem you're trying to solve isn't too big where because what happens is you think you understand it all and then suddenly, oh, I didn't think about this. I didn't think about this.
Mhm.
I didn't think about this. And now it's a year and a half later and you're back to square one. So you've got to find that intersection of those three things that, what can I do? What do I like to do? And what makes money? You have to find that intersection. And it has to be something that addresses a true pain point and something that you have domain expertise in, which translates to momentum. And you have a network of people in that space that you can call upon, maybe bring into the opportunity to leverage and to validate your ideas, which might be a little crazy. You need to hear from people. That makes sense because maybe one of those people say, "Oh no, that's crazy because of this," and you're like, oh, "Dang, I didn't think of that." Right?
Yeah.
Or you may talk to somebody else who said, I know somebody who tried that and it didn't work, or I know this huge company that's already doing this and they've got partnerships with these five huge companies. All right, I'm going to stay away. So that's kind of in a nutshell what I do. Make sure it's the right thing for you personally. Make sure it's a reasonably marketable thing. Leverage what you know and spend time researching.
I love that. I love that. Yeah, I was talking to somebody earlier today just about the fact that, if I'm not happy, I don't want to keep doing it. And so I think that that's, obviously not every day is sunshines and rainbows, but overall, if you want to wake up every day and do the thing, and it doesn't
Yeah.
feel like a job, then you may be in the right space.
Well, yeah, but it's not some idealistic thing. I think what happens is when we love what we do, we're better at it.
Yeah, that's true.
And I think that we make more money at it if
Sure.
we're better at that thing and we're better at it because we love doing it. It all sort of comes together. And, I don't think it's selfish to want to have a job that you love. I
Mhm.
think it's probably necessary for
Mhm.
you to have any level of success.
Well, and
And
then
you,
when you're talking about your overall health, right? It's all related
oh, yeah.
if you're enjoying your day, absolutely. Oh,
Absolutely. Stress is a killer and job stress is yeah, high on that list.
for sure. Awesome. Well, Mark, this has been really fun. I really appreciate your time. And do you have any last advice to anybody that's listening here? And if so, what would that be?
Yeah, I would say it's rare that I've ever spoken to an entrepreneur who has tried something and says, "I really wish I hadn't done that." But I know a lot of people who have had dreams they never pursued and who many years later say, "I wish I'd have done that." You know,
Mhm.
because I think by trying things, we learn a lot and
Yeah.
we make ourselves better, more productive people. And through those experiences, and certainly I've had a lot of experiences, good and maybe not so good, but they've all helped enrich me, I think, as a person, as a resource. So I'd say, if you've got something, go for it, check it out. And it's almost always worth the effort.
Awesome. Well, thank you, Mark Seghers of Inspire Health Tech. I really appreciate your time. This has been great.
Thank you, Crystal. Appreciate the
Thank
opportunity.
Thank you for spending time with me today on Small Strides, Big Business. I hope this conversation gave you some clarity, confidence, or one new idea to move your agency forward. If you enjoyed today's episode, make sure to follow or subscribe and share it with another agent who could benefit. I'm Krystal Small, and remember, every small stride you take today builds the foundation for long-term confidence, stability, and growth in your business.